And welcome to another Ilifa RESEP webinar series, and with Data Drive as well this now in this new series. And we are really pleased to be able to bring some more research to you today, and focusing on the South African education sector. My name is Gabrielle Wills. I'm from Research on Socio-Economic Policy at Stellenbosch University, and I have the opportunity today to introduce to you our speaker for today, which is Jesal Kika-Mistry. She has been working on a paper which is titled Compliance, Cost and Use of Fees in the Early Childhood Care and Education Sector in South Africa. You might have, in the last year she presented on a paper that was titled very similarly. This is not the same paper. She has updated this work using more recent data. So in previous work that she's done to really examine the connections between cost, quality, and fees that parents or caregivers are paying for programs in South Africa. In that work that she's done previously, she used the ECD audit of 2013 and 14. And that was a very useful and important piece of data that was collected more than 10 years ago now, which provided a lot of insight into early learning programs in South Africa. But one of the challenges with the ECD audit of that time was that unregistered programs were highly underrepresented in that data set. And so it has been necessary to update this work using the more recent 2021 ECD Census and the Thrive by 5 baseline assessment data and index from 2021. So without further ado, I would like to introduce Jesal. She is a PhD student at the University of Stellenbosch, but she's also a consultant for the World Bank. And I hand over to you, Jesal. We look forward to the presentation today.
Thank you for the introduction, Gabby. So not to bore you, but today I will be presenting a paper titled Complier Costs and User Fees in the Early Childhood Care and Education in South Africa. And as Gabby mentioned, this paper is an update from the previous paper that I actually presented in 2022. So that was using the 2013-14 audit data, and now we're using the 2021 ECD Census data along with the baseline assessment data. And this paper has also been co-authored with Gabby. So just to kick us off and give us some context of where things stand. So in South Africa, we have twin goals for early childhood care and education in South Africa. There is a need to simultaneously increase access to early learning programs while also addressing low levels of quality in existing early learning programs. So in the literature, one approach to improving the quality of early learning programs is to ensure that they meet norms and standards. So in South Africa, this would essentially lead to them becoming registered and being eligible to receive the ECD subsidy. But there are potential trade-offs in using this approach to improve the quality of early learning services and address the access challenges. So the motivation for this work rests around a registration dilemma that we're seeing in South Africa. So firstly, the norms and standards in policy for partial care facilities and early childhood development programs are set out at a national level in the Children's Act. They are then implemented by provincial departments, so previously social development, now education, through the registration frameworks. Municipalities and local government also further impose additional bylaws and environmental health and safety standards for programs to become registered. At the early learning program level, being fully or conditionally registered may enable a program to access a per child per day means tested subsidy. So this subsidy is an enabler to access early learning services, especially for poorer children or poorer households, where the subsidies are intended to be passed on to the users in the form of no fees or lower fees. But to be able to access the subsidy, an ELP operator has to incur costs to meet or maintain the norms and standards to become or stay registered. And in this pursuit of meeting higher standards to achieve better quality, they may pass on the costs in the form of higher user fees to households. And this may offset the advantages that we see from subsidies to make early learning services more affordable. So this hypothesis associated with this registration dilemma that we're seeing is what we analyze in this paper. So to give you some background on some of the literature that we've come across while trying to do this, the first thing we found is that this market approach to early childhood care and education is what is widely used in developed and some developing countries. And when we say market approach, we mean where these for-profit entrepreneurs compete with one another to get a share of the early childhood care and education market. And in these instances, the state has very little interest or influence on how the services for young children are delivered, established, or how they're maintained. Second is that imposing standards to improve structural quality are not usually uniformly distributed. So what we tend to see in the literature is when standards are imposed, the benefits tend to accrue to higher income households. We then find that the production of high-quality early childhood care and education is costly, and it may also exceed the purchasing power of low-income households or families. We also find that the high costs are a barrier to access, but they do lead to higher standards of programming. And lastly, we found that subsidies are needed to provide more equitable access to quality ECE. So the literature was mainly based on a developed country context. And what we try to do here is to provide a more developing country perspective where these traditional market assumptions that drives quality, costs, and fees don't actually hold in South Africa. And in South Africa, we have more of a quasi-market operated by these informal and not-for-profit private providers that do receive subsidies from the state if they meet the standards for registration and if children in their programs meet the criteria for the incomes means test. So there are several research questions underlying this work. The first of which is, what are the user fees being charged by early learning programs? Do these early learning programs offer fee exemptions? And if so, are there any patterns associated with offering these fee exemptions? Second is, to what extent do the early learning programs meet the norms and standards by their current registration status? And how does this differ across provincial administrations? Third is, what are the trends in compliance with norms and standards, comparing across the 2013-14 ECD audit data that we had and the 2021 ECD Census? Fourth is, what are the overall estimated costs of provisioning in an early learning program? And following this question, we also ask, what are the estimated costs of provisioning in early learning programs meeting acceptable levels of compliance with norms and standards related to structural quality? And when we say acceptable levels of compliance, this was derived by looking at the average proportion of norms and standards that are generally met by fully registered programs, and this will be discussed later on. And lastly, we look at, can government subsidies help reduce the passing on of higher costs to households in the form of user fees? So I will quickly take you through our samples that we had for the data. So building on the approach that we adopted in our previous 2013-14 audit paper, a key disaggregation for us was program registration status. And in this instance, programs that were in the process of registering or where registration had lapsed were classified as not registered. So in total, our sample included 39,342 early learning programs, and this is around 96% of the original ECD Census sample. And the programs that were included, so around 4.3%, were those with an unknown registration status or those that were classified as toy libraries purely because they are just facilities that permit parents or caregivers to borrow toys for a given period, and it's not a full day's or a day's early learning program. We also complement the census analysis using the 2021 Thrive by 5 Index and baseline assessment data, but more specifically the baseline assessment data that was attached to the Thrive by 5 Index. And this was particularly used because it had cost data. And here the sample also includes programs with a known registration status, but we also looked at programs that reported on any income and any expenditure. So we were able to analyze this. And in total, we had about 447 early learning programs from the sample, and it's about 85% of the sample in the baseline assessment. When we looked at the comparison between the 2013-14 audit and the 2021 census, we had to use the audit data. And just to let you know that those were also programs with a known registration status and programs that reported on receiving any income and expenditure. And in that sample, we had around 15,800 early learning programs. So in terms of results, we first look at the ELP user fees and what the implications are for program providers. So this figure presents a cumulative distribution function, and it shows us the likelihood that the maximum monthly fees charged by an early learning program is less than or equal to a specific amount. So we have fees charged at the bottom on the x-axis, and we have the proportion of programs on the y-axis. And we observe, for example, that close to 80%, so where the first green dot is, of early learning programs charge 500 Rand or less per child per month. If we look at other different data points, another example is that we see that 40% charge 200 Rand or less per child per month, and almost zero or a very few programs actually charge 50 Rands or less per child per month. We then look at the percentage of early learning programs offering fee exemptions by fees charged and subsidy receipt. So the 2021 ECD Census data captured whether an early learning program offered a fee exemption to some children in the program. And that is whether one or more children attending the early learning program were exempt from paying fees. And what we need to know is that the nature of these fee exemptions are very likely to be informal, where parents or caregivers are not exempt from paying fees for the duration of the child's enrollment, but that it rather reflects a willingness to overlook occasional or circumstantial defaulting of fee payments on a case-by-case basis. So The figure that we're presenting here has the percentage of early learning programs offering fee exemptions on the y-axis. And on the x-axis, we have two groups. We have the first group on the left, where those are programs that do not receive the DSD subsidy, and the programs on the right that do receive the DSD subsidy. And each of the colored bars represent different fee categories. So you'll see legend at the bottom. We have 1 to 50 Rand, 51 to 100, 101 to 200, etc. And one of the first findings from looking at this is that offering exemptions from paying fees is common, but it's more likely in subsidized early learning programs. That's the one on the right, compared to unsubsidized programs. And particularly so in the higher fee range between 300 Rand and 1,000 Rand. But what we also need to note is that when we looked at the sample sizes here, we saw that in the ECD census, we had a greater proportion of programs that were subsidized and unsubsidized. And in this figure in particular, we see that actually more than 80% of the programs are subsidized. So we have to be cautious in interpreting this figure. The second finding is that fee exemptions are high in poorer contexts for both the subsidized and unsubsidized early learning programs. So that's the purple and orange bars in each of the figure. And this is particularly so where fees charged are 100 Rand or less per child per month. So for subsidized programs, what this could mean is that the subsidies are passed on to users in the form of fee exemptions. But for unsubsidized programs, on the other hand, offering these exemptions to poorer, they offer these fee exemptions to poorer households, even though the income that they receive from fees is likely to be inadequate to cover the costs to meet the norms and standards to become registered and be eligible to receive the subsidy. So this just reiterates this triple burden that we found in our first paper, where unregistered ELPs servicing these poorer households offer fee exemptions despite charging lower fees, and they don't get access to subsidies to cover any of their cost shortfalls. We then move on to costing early learning programs complying with norms and standards. So when we looked at compliance with norms and standards, we look at it as an indication of structural quality, and I'll explain this a little bit more. So what we've done first is we set out the norms and standards for partial care facilities and early childhood development programs from the Children's Act and the associated general regulations. We then mapped these norms and standards against variables in the ECD census to establish whether the early learning programs are meeting them. And in brackets, I have here that this is indicative. And what we mean is that the variables mapped from the 2021 census at a facility level to the norms and standards are more indicative than precise, because all the norms and standards in the Children's Act and regulations, a lot of them cannot be quantified. And we also did this considering, what does a safe environment and one that's conducive to early learning, like what does that look like? So it's actually not one-to-one precise indicators, but it's a best match of what we could find. The focus of the norms and standards are also related to structural quality, and this mainly refers to aspects of the physical environment, such as infrastructure and group characteristics, such as child practitioner ratios, practitioner variables such as years of experience and qualifications. And the norms and standards in the Children's Act also include some aspects of process quality, that reflects a child's learning experience, particularly interactions with teachers, peers, and materials in the early childhood care and education setting. But the 2021 census data mainly measures variables capturing structural quality, and so did the 2013-14 audit, and hence the focus of this paper. So next, we're showing, the norms and standards from the Children's Act and an example of how it was matched to variables from the 2021 ECD Census. So, for example, the first line states in the norms and standards says that children must experience safety and feel cared for whilst at a partial care facility. And we match these to 3 variables in the 2021 census. So the first one is that an ECD program has a fence around the premises. The second is that the ECD program has a lockable gate to provide unauthorized access to the premises. And the third is somebody is checking who enters and leaves the facility. So this is an example of how we matched variables to the norms and standards. And also note that not all the norms and standards are included. It was all included based on the indicators available from the census data. So in total, we were able to match 20 variables from the ECD census to the norms and standards for partial care facilities and early childhood development programs. So next, we look at our norms and standards being met. And apologies, this table is quite small, but I will paint the picture of what it represents. So in this table, we're reporting on the proportion of programs by registration status, and that's the different columns that are meeting each of the requirements. And these items are ranked according to the proportion of early learning programs meeting each item-specific requirement, starting from the highest to the lowest. So the blue highlighted cells are the higher ones, and as we move to orange and get towards the darker orange, they are the lowest met indicators. We also just want you to note that the sample here is limited to those programs that report on all the specified items, so all 20 of them, and have no missing values for them. So the sample here is a little smaller than our initial sample. So what are some of our key findings here? First, we found that some of the legal requirements are seldomly met, regardless of the ELP registration status. So if we look at the bottom, where the cells are mostly highlighted in orange, the least attained items include a program having evidence of an ECD curriculum, having a flush toilet, having tap water on site, and having at least 10 support materials available to children in the program. And in contrast to this, we see that more than 90% of early learning programs, regardless of their registration status, are likely to have a fence around the premises, and the available source of water that they have is drinkable. The second finding is that compared to fully registered early learning programs, unregistered early learning programs are less likely to meet certain norms and standards. So, for example, about 71% of unregistered programs show evidence of a meal plan compared to 89% of fully registered programs. And one could deduce that fully registered early learning programs tend to pay more attention to nutrition, which could be attributed to them receiving the subsidy, and a significant portion of which is earmarked for nutrition. The third finding is that there is significant variation across provinces in the extent to which norms and standards are being met by fully registered early learning programs. And I will show you this in the next slide. So again, this is quite small, but what this table essentially represents is item level differences in fully registered early learning programs meeting the norms and standards by province. So each column represents a different province. So here it's worth noting that Gauteng and the Western Cape, which are our more urban provinces, are more likely to meet the norms and standards compared to some of the rural provinces. So, for example, 99%, so you'll see here I've highlighted it in blue, so item number 18, 99% of programs in Gauteng and the Western Cape have a flush toilet compared to 30% in KwaZulu-Natal and 44% in the Eastern Cape. And similarly, with having tap water on site, about 99% in Gauteng and the Western Cape have tap water on site compared to 48% in KwaZulu-Natal and 52% in the Eastern Cape. What we also see is that both Gauteng and the Western Cape are more likely to meet norms and standards as related to offering classes for children in different age groups, operating in a formally built structure, having an indoor floor area that's large enough for children to move around safely, and also staff trained in first aid procedures. It's also less clear to us whether rural provinces are less stringent in their application of certain norms and standards, and what the observed differences could be attributed to is deviations in how the indicators were defined relative to the norms and standards, and also how these indicators differ across registration frameworks. What we then look at is trends in compliance over time. And to assess this, so to be able to assess the trends in compliance between 2013-14 and 2021, we compared 10 variables that were relatively consistent across the 2013-14 audit and the 2021 census. And although the wording of some of these questions differ slightly, the variables were coded consistently. So, for example, these are just two out of 10 variables. So in the 2021 ECD Census, the question is around, is there a fence around the premises used by the ECD program? Whereas in the 2013-14 audit, it was, does the center have a fence about 1.8 meters high around the site? The second example is from the 2021 ECD Census. The question asks, which meals do the children eat at the program, at this program, and it gives them a selection and who provides the meals that the children eat at the program. Whereas the 2013-14 audit asks, does the ECD center provide a meal or a snack? So it's not necessarily the case that the classification of questions was easier to achieve in the 2021 census compared to the audit. So this bar chart presents the percentage of fully registered early learning programs meeting norms and standards in the 2013 ECD audit. So these are the 10 variables that we selected for comparison, and the 2021 ECD Census. So the orange bars are the 2013-14 audit, and the blue bars are the 2021 census. And on the x-axis, we have each of the variables, and on the y-axis, we have the percentage of fully registered programs meeting these norms and standards. And what we see here is that there are noteworthy improvements observed between the two time periods, but we saw a slight decline in tap water, and we could explain why this will be the case in the next slide. So this figure presents the same figure as a previous one, but for unregistered early learning programs. And here we also observe improvements for 9 out of 10 variables. And despite the improvements in these unregistered early learning programs meeting these 10 norms and standards, there are other norms and standards that they're probably struggling to meet, in addition to the bylaws or standards imposed by municipalities and local government that are preventing them from becoming registered, sorry. But a limitation of this comparison between the two periods is that the samples are not the same. And relative to the 2013-14 ECD audit sample, the 2021 sample included a greater variety of programs, specifically poorer ones due to the sampling method used. But the 2013-14 audit, on the other hand, was based on known early learning programs and really did not include those that were less visible. But we note that both samples are likely to miss the smallest and the poorest early learning programs. And COVID-19 could have also compromised the sustainability of the poorer programs, reducing their inclusion in the 2021 ECD Census sample. And this is a problem that we think would have affected the unregistered programs a little more. So we then move on to meeting metrics of compliance with norms and standards, and we think about what is a satisfactory level of compliance with norms and standards. So in order to cost programming with higher standards, one approach is to identify what costs are associated with programs meeting all 20 of the norms and standards as a proxy for structural quality. But programs with full compliance don't provide a large enough sample for the required analysis. So what we found is that only about 16% of fully registered programs met all 20 of the norms and standards. So we therefore focused on programs that are meeting 4/5 of the norms and standards, and this is about 85%. And the reason for this cutoff is that fully registered early learning programs were more likely to comply with about 85% of the requirements. And what we then just show the percentage of early learning programs that are compliant. So this is now compliant with the 85% of norms and standards, so 17 of 20 by province and registration status. And what we see here, if we look at the figure by registration status on the right, is that only 66% of fully registered early learning programs satisfy 17 of the 20 identified requirements. And this reveals this notable incongruity between the norms and standards in the Children's Act and the de jure registration requirements for ECD programs and pastoral care facilities. And we also see significant variation across provinces. And this should prompt some inquiry into what reasonable norms and standards should be, and whether there's more room for us to be more flexible to accelerate registration. We then look at the estimated costs in all early learning programs and early learning programs meeting this acceptable level of structural quality or compliance as we define it. So the available cost information in the baseline assessment reflects only the direct or operating costs of an early learning program. So these are costs that include salaries or stipends, food, rent, admin, lighting, heating, cooking, water and sanitation, maintenance, building costs, and child and practitioner materials. It does not include any overhead costs, for example, professional development costs or any imputed costs such as volunteer time or materials that were, for example, donated. We're also quite sensitive when we produce these cost estimates of when we include wealthier programs in the analysis. And for the cost estimates that we show, the wealthier programs were excluded because they might have more financial resources to meet the registration requirements, or they might be disincentivized to register in the first place because their income can actually cover the costs. So in this paper, we defined wealthier programs as those charging more than 700 Rand per child per month, and those were not included in the cost estimates that we provide. So the figure here presents the median unit costs for all early learning programs. Those are in the blue bars, and the more compliant early learning programs. Those are the ones in the orange bars and meeting at least 85% or 4/5 of the norms and standards. And we also present the typical subsidy value in green. That's a 17 Rand per child per day. And in terms of findings, what we can clearly see is that the subsidy amount is highly inadequate to cover the costs of provisioning in all ELPs and more compliant early learning programs. So for all early learning programs, that's the ones in the blue bars, the costs associated with running a fully registered program, that's the bar in the middle, are over 3 times the subsidy amount. So you're looking at 55 Rand compared to 17 Rand. Then if we look at the costs associated with running a fully registered early learning program compliant with about 4/5 of the norms and standards, these costs are more than 5 times the current subsidy value. So around 93 Rand compared to 17 Rand per child per day. And in the last part, we quickly look at, do subsidies mitigate the passing on of higher costs to households? So this figure shows us the association between a standardized index of compliance and the maximum fee charged per month. So we constructed this index using the 20 variables in the norms and standards list. And the figure is a local polynomial regression with the highest fee charged per child per month on the y-axis and the standardized index of compliance on the x-axis. And we show this by registration status on the left, so that's a green and red, and by subsidy receipt on the right, so that's the yellow and blue lines. And what we observe is that monthly fees increase with higher levels of compliance. The second observation is that fully registered early learning programs, so that's the green line on your left, charge lower fees for a given level of compliance compared to unregistered early learning programs. What we also see is that subsidized early learning programs, that's the figure on the right, and the blue line, charge lower fees for a given level of compliance compared to unsubsidized programs. And what this could possibly imply is that higher costs, the higher costs incurred by fully registered early learning programs to meet a certain level of norms and standards are not necessarily passed on as higher user fees, which are offset by the receipt of subsidies. So to further explore whether subsidies help reduce the passing on of these higher fees to households in the form of higher user fees, we used a multivariate regression analysis where the key control variable was subsidy receipt. And the multivariate regression, we also control for other program characteristics, for example, the province or the nearest school quintile. And we also control for the monthly costs per child. And what we did was we included an interaction term between the total cost variable and the subsidy receipt. And this was to see how the relationship between costs and fees is affected by the subsidy. So this figure presents our estimation results, and it shows the realized fees per child per month on the y-axis and the total cost per child per month on the x-axis. And the gradient or the slope of this fee-cost relationship is flatter in subsidized early learning programs. So that it's a bit unclear to see, but it's the red lines compared to unsubsidized programs, and that's the one with the blue lines. implies is that subsidies are important in mitigating the costs being passed on to households in the form of higher user fees. So the marginal effect of an increase in user fees associated with an increase in costs is higher for unsubsidized programs compared to subsidized programs. And the sample here of unregistered early learning programs is quite small, and this is why we're seeing this larger confidence bands. But in our previous analysis, this picture was quite clear. What I'd also like to say is that in the previous paper with the 2013-14 audit data, the legends, there was an error with the legends where they were mixed up, but we have updated this. So please do download the most recent papers from the Ilifa website. Okay, and lastly, just a quick summary of our findings. The first is that a small fraction of early learning programs, including fully registered early learning programs, are wholly compliant with norms and standards related to structural quality. Second is that looking at trends in compliance between the two periods, we observed improvements in compliance for both fully and unregistered programs, but we do take note of the differences in the data samples. The third is that higher levels of compliance are associated with higher user fees, but the fees passed on to users are lower for registered or subsidized early learning programs compared to unregistered or unsubsidized early learning programs. Early learning programs receiving the subsidy are significantly more likely to offer fee exemptions than programs not receiving the subsidy. And lastly, the current value of the subsidy is highly inadequate to cover the operating costs of running a compliant early learning program, but it still contributes to lower fees being passed on to parents or caregivers for a given level of compliance. So the subsidy, therefore, supports the twin goals of improving access and quality, but there are trade-offs in expanding the reach of the subsidy at its current value to more children and raising the value of the subsidy. So some of our policy recommendations is that the compliance requirements in registration frameworks need to be simplified to enable programs to become fully registered and access the subsidy. The requirements should also be consistently applied across districts and provinces, and it should be done in conjunction with a review of the costs associated with meeting these norms and standards. The government also needs to track unit costs, which should also include imputed and overhead costs, and this will help us to set the subsidy value more appropriately to reflect costs. And lastly, we need to consider including some questions related to income and expenditure in the larger ECD census. So although the baseline assessment does include these cost questions, the sample sizes are quite small for us to do this analysis properly. Thank you so much.
Jesal, thank you very much for such a clear presentation of this work. And yeah, thank you to, there are already some questions. I see there's one in the Q&A, and there've been some comments in the chat. And if you have any questions now, you could either put those please into the Q&A. Alternatively, you can raise your hand if you want to speak verbally and raise a question, and we can take that. So yeah, I think let's just have a look. There's a question here. There's one already in the Q&A, Jesal.
Happy to answer that. So the data was actually collected on site by a different team. So it wasn't us collecting the primary data itself. The data was collected from the 2021 ECD Census data that was also led by the Department of Basic Education and the Thrive by 5 and baseline assessment data was also led by the data drive team. So we used the data that they had collected for this analysis. Thanks.
All right, and then there was there were some questions as well in the chat. So one of them I already answered on our behalf. Jesal was around the choice of the questions to compare across the 2013 and 14 ECD census, and then the ECD audit, and then the ECD census of 2021, and that really being driven entirely by the comparability of actually what was the most comparable questions. But there's another question that's asked. There's quite a sharp question here. So there's someone who's raised a point about the axes. I think there was the title of one of the slides says unregistered, but the axis says registered in the previous graph. I couldn't quite remember where that was. And it might also relate to this other comment, so you probably can do it at the same time, about someone here, Taran, that there's an overlap in confidence intervals between the 2014 and 2021 in the previous slide, and can you potentially comment on that? I thought that was a really, someone's really paying attention, which is great. Perhaps if you want to consider that.
Yes, I'm happy to address. So yes, sorry, the comparison of the 2013-14 audit and the 2021 census, the second slide, the axis was supposed to say unregistered. So thank you for picking that up. And the overlaps in the confidence band. So we do know that the sample sizes here are a problem. They're also not comparable. So even though we do see slight improvements, they're not necessarily statistically significant improvements that we're seeing. So I just want to address that. But I also see that Sonia has put a question in the Q&A about, are there potentially opportunities for improving the targeting of subsidies for the poorest? And Sonia, I think I'll maybe start, and if Gabby has anything else to add, but I think here the biggest thing is around getting these centers registered and providing income support for this to happen. So what we generally tend to see is that the standards that they struggle to meet are a lot of the infrastructure standards. And I think here is where, for one, the conditional grant could be very valuable, but also providing any additional type of infrastructure support to these centers to help them get registered to get the subsidy. They're essentially programs that are really struggling to get registered and get the subsidies to the poorest children. I don't know if Gabby would like to add anything else to that.
No, thanks. That's great. I just want to go back to the Q&A. So I just want to highlight Amachido Alice Bakisi. We didn't read out your specific question, but Jesal did answer it. So how did you asked the question, how did you conduct your assignment? Did you do this on-site visits, or did you collect the data from the Department of Education? And as we mentioned, this data is already collected. Both the ECD audit, it's collected as a program of data collection, and similarly with the ECD audit. So we don't collect it ourselves; it's collected as a much wider system organizational exercise. So yes, and then there's another question here, Jesal, from Turin. I'm not so sure if I've said that correctly. Apologies if I got your name incorrect. But why does the paper focus on the norms and standards as defined in the Children's Act instead of the recent published registration frameworks for ECD programs and partial care facilities? I think this is an important question, and if you could comment on that, that would be good.
Sure. So at the time of writing this paper, and initially when we had done this, I think we started this work in around 2019, 2020. And at the time of writing, the registration frameworks were not yet published. And the idea at that point was to focus on, what is legislated in the country through the Children's Act, and how could we do this better? And I think perhaps future research, what we could now do is perhaps instead of doing it with the norms and standards, we could do it against the registration framework and see if we come across any substantial differences there. So thank you for the question. It is important for us to note that.
All right, and there's another, before I jump to Colin's question, there was a question from Linky Nkuna, and she said, was the research done in both rural or urban areas or both? If you'd like to comment on that.
Yeah, so I think from my understanding of the data, it was done in nationally representative samples across both. So the census was broad, it was across the country wherever information was available. And the Thrive by 5 data and baseline assessment were conducted in a nationally representative sample that covered both.
I think before, Colin, before I answer we respond to your question, this question around the sample and the representativity and the national representativity of the ECD Census of 2021. I wonder if it's perhaps worth commenting on this, Jesal, and just how this was done. So how was the sample, or how was the census actually determined and collected? And do we think that it reflects the full gambit of ECD programs in the country? Or what programs do we think potentially are missing from that census? Do we think it really is a census, or do we think that there are programs that are missing? I think that really is my question.
Thanks, Gabby. So I don't recall the full process of it, but from what I've understood is that, the starting point was the Department of Basic Education and the school's master list data, and then contacting the schools to try to look at centers that were within a particular radius or where children were coming from to those schools. And from there, it also drew quite a bit on the Fangasali campaign that tried to gather data in different areas. And from my understanding is that was the first starting point, and then a snowballing attempt was also used to collect data. And I think one of the things that we think might be happening here, and from what we're finding, where still a lot of the programs are subsidized, a lot of them are registered, there might be these smaller, poorer, and less visible programs that may not necessarily be included. So even though there were these, registration jamborees and all of that happening, and they tried to gather a lot of data, there is still a risk that we are still missing these very vulnerable, smaller early learning programs.
Thanks very much. And I also just want to, I think it's worth just a bit of a shout out to organizations, the DBE, which really took some serious initiative in trying to develop a census framework, and also supported a lot by Dr. Drive in their efforts around the Thrive by 5 survey. And I really just want to just commend just groups of people that have taken this very seriously, that have tried to create a frame of data that we haven't had to this extent, so that we can actually identify where and who these programs are and who is running them and where they are in the country. It's really a huge step forward for understanding the sector. And I just want to commend everybody that's been involved in that process. It really, as researchers, it also gives us data to understand the system and to do things with as well. But really from a system point of view, it's entirely and very necessary in order to really drive improvement and to move forward. So congratulations and well done to those that have been so integral to that. So we have a question from Colin Almale, and he says, great presentation. Agree, well done, Jesal. And are there ideal questions that should be asked in a future ECD census to better understand income and expenditure? And then on top of that, one more question. Did conditional registration come out as any different in the analysis as compared to fully registered and unregistered early learning programs?
Sure. So I'm going to take the first one, and I might divert to you, Gabby, for the second, if there was any input on this to the team. But Colin, so what we found was that the conditionally registered, when looking at norms and standards being met, were quite close to the fully registered. We didn't see like massive differences there. The massive difference was the unregistered. So, the conditionally registered ones could also possibly be receiving the subsidy, and we do see that they do resemble the fully registered programs to quite an extent. I'm going to ask Gabby if she'd like to come in on the second bit. I personally haven't given this too much of thought. So over to you, Gabby.
I think one of the challenges with asking people to report on costs and expenditures is obviously difficult. You have recall bias challenges, and sometimes people don't even keep a good record of their costs and income expenditure. I mean, if I were to come to Jesal and say, Jesal, how much did you spend on groceries last week? Unless you've got a recorded system of doing this, it's quite challenging. Nevertheless, what we've seen from the ECD baseline audit and from the ECD audit of the earlier years is that having something is better than nothing. And even if the exact levels are not correct, you certainly see the patterns and the distribution. So even if we just repeated the questions that we'd had in the 2013 or 14 ECD audit, it will give us something that is far better than nothing. And so we're not going to get a perfect instrument, but we do need something. And I think it's the patterns that become extremely evident and are particularly useful to look at from a research point of view. There's a question from Dr. Machemo Kumalo. If someone has land and the knowledge to open a compliant ECD center, but lacks the financial resources or infrastructure to build it, where can they seek help and support from? Jesal, do you have any comments here? Perhaps there's also others in the actual group itself, the participants.
Yeah, so I think from a research perspective, this is a bit tricky for me to answer. I mean, I would think your first point of call would be your provincial education department and the responsible officials there. But I'm not sure if anyone else on this call could actually have some insight into how you could do this better. You're on mute, Gabby.
And there's a question from Stefina Magakwa. Are early learning playgroups programs included in the research, or potentially in this case included in the sample?
I actually can't remember this one here. But from my understanding, I think they were included. I think what was not included was parenting programs, for example. But Gabby, I think it's time for us to wrap up. We have 1 minute left. And I just want to say thank you all for joining and connecting. It was great to have such a good group and such an engaging group on this work.
And I think it's also just important to highlight on the 7th of August will be the next webinar. This is going to be a presentation by Dr. Grace Leach and Professor Dieter van Vintel on promoting early childhood development through multidimensional service delivery in South Africa, a municipal view. And so we look forward to seeing you all again on the 7th of August. And thank you again for your participation, your questions and engagement today. Thank you, Jesal, as well. Bye-bye.
Thanks. Bye.